Hello, I'm Dr. Paul Conley, and thanks for tuning in to another episode of Doc Talk. Tonight we are here at Plateau Medical Center, and we are actually in the Infusion Center. Plateau Medical Center just recently had a ribbon cutting ceremony to basically kick off this Infusion Center, which is something that we're going to talk about tonight. We're going to talk a little bit about what is an Infusion Center, what kind of patients we can serve with the Infusion Center right here at home. So first of all, I want to introduce Skyler Duncan. Skyler is actually a registered nurse here at Plateau Medical Center, and Skyler really helps spearhead the Infusion Center, and she's going to be someone that patients that are going to come in are going to meet with Skyler. So Skyler, thanks for coming on the show.
Thank you for having me.
So Skyler, I think a lot of people watching this show may not really understand what an Infusion Center is. And I think that, some of the people that do know what an infusion center is, and maybe they receive medications that require an IV, maybe you can tell me a little bit about, with our infusion center here, what are some of the amenities as a nurse, so when a patient comes to the infusion center, that they can feel comfortable, relaxed while they're getting their IV medication?
Yes, we have a lot of different amenities here to accommodate the patients. We offer a variety of snacks to patients while they're here, a variety of drinks. We got these new infusion chairs. They offer heating, massaging, they recline almost all the way back into a bed, and they also have USB charging on it. We have free Wi-Fi here that patients can connect to, and TVs for the patients.
So when they're getting their infusion, Skyler, because I've kind of enjoyed this chair actually, we just started the show. So they actually have this nice cozy chair they can kick back, they can relax. And to your point, I was looking here at your chair, I see that there's some buttons here that the patient, now can the patient control these themselves, the heat, the massage and all that?
Yeah, absolutely. The heating has 3 different modes to it, high, medium, and low, and the massaging feature actually has a bunch of different intensities, different patterns, different intensities for the massaging.
So if I'm here getting my infusion, getting my IV, I can kick back. I see there's big screen TVs that or behind the cameras here, and we got 2 giant screen TVs back here, and so they can either be playing on their phone, you got Wi-Fi, they want to watch television, got the clicker, change channels, but they also can change the heat, the massage while they're getting the infusion.
Absolutely.
Well, that makes it great. So it makes it more personable, and actually the patient may feel like they're getting the infusion at home. Mm-hmm. But I think some places will go to a patient's home for the infusion, but I also think that some patients don't like someone coming into their home to get the infusion. I mean, the home is home, and that's sometimes they don't want strangers mainly coming in, but here you can actually feel like you're at home because you're going to get the infusion, and you're going to have probably a better chair than you even had at your house, because I know I don't have a chair like this, although I want to talk to administration about that and see if I can't get one of these. So when it talks about some of the other things, when a patient comes up here, Skyler, maybe you can walk me through a little bit about the patient experience. So when they come into the hospital, they've never been here before, maybe you can kind of walk me through what the patient might expect before they get back here to this chair.
Physicians normally send the referral over to us, and our scheduler will call the patient, get them scheduled, and walk them through the process of how exactly to get here. So they'll come into the hospital, come up to the 2nd floor. Our registration is on the same floor as us, and they register and come straight back to us. So it cuts out a lot of the middleman.
I think, one of the things that, I think patients that may be receiving these infusions, they may have some comorbidities or some other medical conditions where this infusion center is separate from our quote-unquote med-surg floor, where we may be treating patients that may have some infection, and may have COVID, maybe they have flu, maybe they have pneumonia, and we really would like to separate a well patient receiving infusion to someone that may be sick. And so I think patients can feel comfortable with the fact that they'll come in and they'll come straight up to the 2nd floor, and then that's where they register, which is just right down the hall from here, right?
Yes.
And then they'll come to you, and then that's where you will, get them hooked up and bring them here to the infusion center. Mm-hmm. I think people are nervous, they're scared, they're in a hospital, and we talked about sometimes, there's a difference between receiving an infusion at home versus receiving an infusion in a center. patients, I do think that may feel a little more comfortable in the hospital because also they feel like their healthcare provider is here. So if there would be any other things that may go on, and maybe you can talk to me a little bit about that, because I do know that sometimes patients will come to you as a nurse, and maybe you might pick up on something that, maybe the patient says, my legs have been swollen for the last 4 days. I know I'm here to get an IV iron infusion, and I've been really short of breath. Getting in front of you, that way you can even maybe reach out to the provider. And is that something that sometimes you do?
Oh, absolutely. We have a lot of patients that come in and will ask us those questions. Sometimes we're able to give them a little bit of advice, but we're also able to reach out to the provider and sometimes get a hold of them faster than the patient would be able to. And they will either give us orders or tell us what to do with the patient.
I do know that sometimes you've even reached out and called my office and said, hey, just by the way, this patient presented today, but they got some congestion, and maybe they have something else that you pick up on, because sometimes we don't see these patients maybe every 3 or 4 months, but they are probably going to see you more often than their own provider, because if they're up here getting, let's say, an iron infusion, and they're up here maybe getting an infusion like once a week or something like that, you're going to have a chance to see that patient and be in front of that patient even more so than the provider that actually order that infusion.
Yes.
What about family members? Is it okay that I bring a spouse, or is it okay that I have some family member be with me during the infusion? Is that something that is allowed in the infusion center?
Absolutely. We offer other chairs here for family members, support persons, to sit with you during your infusion. That way you're not alone. A lot of our infusions are shorter infusions, but we have some patients that are here for blood transfusions all day, and we don't want them to be alone during that time.
How many people, Skyler, can you take care of at one time in this infusion center?
We have 4 of these infusion chairs, and we also offer a bed to patients for the longer infusions.
So you can basically at any given time have 6 patients at a time?
About 5 patients, yes.
5. Maybe you can also explain to the folks, how long would they expect to be here? So it's a patient who maybe they're undergoing chemotherapy, and the chemotherapy has caused the patient to have anemia. And so their physician, maybe their oncologist, orders a blood transfusion. What kind of time frame are we looking at for someone to receive a blood transfusion from start to finish before they go home?
It really depends on the patient and how well they tolerate it. I would say most patients for 1 unit is about 3 to 4 hours from start to finish. However, each unit of blood can run up to 4 hours. So anywhere from 3 to 4 hours for 1 unit, and about 6 to 8 for 2 units of blood.
So as far as that goes, is that pretty much, can you transfuse somebody 2 units of blood at a time?
Yes, we do that all the time.
Pretty much if you need more than that, you would have to come back. So basically you can do up to 2 units. Now, what about other things such as injections? I know there's some things out there other than, let's say, a blood transfusion. Some people may have osteoporosis, so they've been diagnosed with osteoporosis, and maybe they have some gastroesophageal reflux. They have issues taking a pill. When we think about bisphosphonates, like things like Fosamax or Beniva, Actonel, and their doctor orders an injection. The one most common we think of is like Prolia, and that's not something that they can do at home. Even though we say the word infusion, is that something that can be performed up here at the infusion center? Yes,
we've actually started getting a lot of the Prolias. Super quick for the patient, in and out probably within 10 minutes. And we just schedule them out every 6 months.
If you have a patient, let's say a first-time infusion or a first-time injection, do you hang on to the patient for any length of time just to check on before they go home, or what's the process with that?
It depends on physician orders, and again, according to what medication they're getting. I know a lot of our iron infusions, first-time infusions, will hang on to patients for at least 30 minutes to make sure they don't have an adverse reaction.
So yeah, when we think about iron infusions, sometimes an individual may have iron deficiency, and they just can't tolerate oral iron, the pill. In fact, in my practice, most people just really can't tolerate that. They either have constipation, GI upset, indigestion, and they're just not really going to take it. Their stools will turn black. They'll have some issues there. And so iron is something that you can actually give intravenous. And so with that, because I know I send a lot of patients up here for that, how long is a typical infusion for a common medicine called Benefer, which is a form of IV iron? How long does it usually take to get an iron infusion?
Typically about 30 minutes.
30 minutes, you come in, you get it, and one of the nice things about when you get an IV is that medication goes directly into your bloodstream and then goes right into the bone marrow, and then of course it's right where it needs to be, versus when you take it by mouth, you don't absorb that much. That's why your stools turn black. And it also makes it concerning to the patient, because then they don't really know if the black stools is from the oral iron, or do they maybe have some bleeding going on. So it's actually a really great way to get someone IV iron over oral iron. So, well, Skyler, I just want to tell you thank you so much for what you do up here at the Infusion Center. I know you do a great job. I know that the community really, really appreciates you. And so I just want to tell you thank you so much, and looking forward to working with you more in the future. So we're going to take a break because the guys are telling me that I'm running out of time. We're going to come back in a few minutes, so stay tuned.
You're watching Doc Talk with Dr. Paul Conley on WZTS 16 Cozy TV. Stay with us. We'll be right back after these messages.
Vandalia Health is proud to be a West Virginia-owned healthcare system, bringing together the hospitals and providers of CAMC, Mon, and Davis. We are dedicated to enhancing the health of our communities through clinical excellence. Our compassion and commitment remain the same, with people you know and trust to care for you and your families. With more specialists, hospitals, and outpatient locations, we are delivering expertise and state-of-the-art care. Vandalia Health, expert care close to home.
Doc Talk with Dr. Paul Conley continues on WZTS 16 Cozy TV.
Hello, I'm Dr. Paul Conley. Thanks for coming back to Doc Talk. So we are here at Plateau Medical Center. We're actually in the Infusion Center, and we've been talking about what an infusion center is and the type of patients that we serve with this. So I now have Brad Walls. Brad actually heads up the Infusion Center over here. Brad Walls is also our quality coordinator, quality management director. And Brad, I know this has been something that you have really, this is kind of like your baby. I know that you have really strived, and you put a lot of blood, sweat, and tears in this infusion center. And we just recently had a ribbon cutting ceremony that we celebrated here recently about the fact that we are now able to provide another service line here in this community here in West Virginia. So, one of the things, we just had Skyler on, and Skyler was telling us a little bit about, from the nursing standpoint, how the patient, present and where they register up here on the second floor, and basically just kind of went over the chairs and everything that we're sitting in right now. I want to know, how does this center improve the care and the access for the patients that we serve?
Being a part of Vandalia Health System, our mission and goals is to enhance the community's health. And one way to do that is by providing quality care close to home. A lot of this service was needed in this area. A lot of our patients were going to Charleston, going to Morgantown to see specialists, and then they were going to have to turn around and go right back to receive the specialty medication infusions there. Well, the need arose for us to create this unit here so people can actually get that care closer to home.
One of the things, that we've talked about, because, we're both local. We're from here, West Virginia. We've trained in other places, and we moved back home. And I always like to think that we can provide big city medicine with hometown care. To your point, some of these patients may travel to a tertiary care center, have a diagnosis that they require a specialty medication that they can't take at home. Sometimes these medications, again, are given intravenous, and so they can't do that at home per se, and they can come right here to our infusion center and receive that treatment. And they may still be directed as a provider off-site, but they can come here and get that medication. So I think one of the things that we talk about is scheduling. Patients may watch the show and say, all right, that's great, you have an infusion center, I'm super interested, but how do I go about scheduling and how do I get to the infusion center here at Plateau?
We provide basically a one call does all service here. We have a number that you call, we give it to your provider, they call us, we take care of the prior authorization, we take care of the scheduling, we take care of all of that and make it easy on the provider and the patient to get it all done with one call and get you scheduled and get you in here.
Yeah, I think, we're going to have that number on the screen, so, we'll have that number pop up so people can see that, you contact that number. And again, I think that, if you're a patient that you're receiving an infusion and you're having to travel, outside of the area, you don't need to do that. You call the number, talk to your provider, say, hey, you know what, I can get that same medication here closer to home. And we think about specialties, Skyler, who was on earlier, was talking about sometimes it may be a cancer patient who's, requiring a blood transfusion. But there's obviously other specialties that use specialty meds. Other specialists, and we think about specialty meds because these aren't your typical medications that you can take by mouth, something like blood pressure pill, cholesterol pill. These are medicines that may have a specialized condition. So what other specialties, Brad, are we talking about that may also utilize this infusion center?
As you're well aware, gastroenterology is a big one. Neurology, dermatology, oncology. There's a certain type of medications called biologics that kind of covers the whole broad spectrum of anti-inflammatory diseases. Crohn's disease, irritable bowel syndrome, those medications are what's considered specialty medications, and we do offer those here. That's where you can go see a specialist elsewhere, get your medication, get your prescription, get it done here, close to home.
You're right. So in my line of work, you'll see a patient that may have, as you said, an inflammatory condition, inflammatory bowel disease, ulcerative colitis, Crohn's disease. And, these are medications that, when I was in medical school, the very first one out was infliximab, which was Remicade. And people may know Remicade, people may watch the show, may actually still be on the drug. And if you're familiar with infliximab, Remicade, it can only be given up until recently IV, and you had to get an infusion, and the patient would have to come in every 6 to 8 weeks and get that infusion. And so when we think about biologics, these are medications that are created into a laboratory and they block immune responses. And so when we think about Crohn's or ulcerative colitis, that's an inflammatory bowel disease. But there's also other inflammatory conditions. You talk about rheumatology, you may be thinking about things like rheumatoid arthritis, psoriatic arthritis. But from the dermatology standpoint, I think, you can't hardly turn the television and watch a commercial where someone's talking about they have psoriasis and they talk about skin clearing. But people may not realize when they watch these medications on television that many of these medications are specialty. You don't just go to the local drugstore and pick them up and take them home. You would have to receive an infusion. I do know as a healthcare provider, one of the biggest gives me heartburn is prior auths, pre-certs. It's not as simple. I think, sometimes the patients say, hey, I saw this girl on the beach and she was getting Skyrizi, and Skyrizi cleared up her skin. Doctor, I want that drug. And so there is a process with the prior authorization, pre-certification. So maybe you can walk me through that part from an administrative side. What all can you offer and help out the patient to make sure they get that drug?
Yeah, not all insurances are the same. We can't paint them all with the same brush. Everybody has individual needs. We offer different programs here. There are some programs through the drug companies actually that'll provide some of those drugs at a reduced copay, even no copay. So there are programs available.
So when we think about programs where our team will help with that, one thing about this infusion center that we've been able here at Plateau Medical Center to achieve is to get the status of what's called a 340B pharmacy, and that's something that not every doctor's office, not every infusion center has. So maybe talking about these plans and programs. So what exactly, if someone says, hey, Plateau Medical Center, they have infusion center and they're 340B, What exactly does that alphabet soup mean, 340B? What does that mean?
Well, 340B pharmacy status is something we strove for. A lot of rural hospitals, a lot of rural clinics and pharmacies strive for this. Basically what it does is it's a government subsidy where we can get drugs at a discount, at a lower cost, and we can pass that savings on to the patient.
So I think that's also important to know is that not only, does the patient not have to travel as far, but with 340B pricing, as we like to use that term with that pricing, it lowers the price point many times, not every time and not all the time, but there's a good chance that that drug, we can get that at a lower rate, that we qualify, just like Plateau Medical Center, people talk about we're a critical access hospital. And so, the government has looked at hospitals in rural areas, like where we are here in West Virginia, we're in a rural area. And so we get government subsidy, government funding, which helps lower that price point, which we can then pass that savings along to our patients that come here. So, one thing I think people also too that, that have these conditions, some of these folks, they work. Maybe they have issues with transportation during the week. Maybe they don't drive when the husband works. Maybe they're looking at hours, or they're watching the show, Brad, and they want to know, well, this infusion center, what are the hours in the infusion center? Maybe I might need a Saturday. So what exactly, with this infusion center, what kind of hours do we run? Skyler's talking about blood transfusion. Once she said that we actually may take up to 8 hours. So obviously with that, we know that we're going to be open for more than just a few hours a day. So tell me a little bit about when are we open and what days of the week?
Well, currently we're open 8 to 4:30, Monday through Friday, but the demand is increasing, so we are looking at increasing our hours through the week. And a case-by-case scenario, some weekend infusions can be made depending on the drug and the product that's needed. So any questions, just call our number that we gave, and we can discuss it.
Brad, you've been, a really wealth of information, but also I can tell you, you've been a great advocate, because I know personally I've had a few patients that I've actually literally contacted the infusion center, reached out to you because this individual, they work out of town, maybe they drive truck, or maybe they work, out of the community, and there's just no way that they can be here during the week. And I do know that we have made arrangements for those individuals to receive that medication. I'm going to walk back a little bit about, because as I've been thinking about this, because in fact one of the patients actually was an injection that I think about that has a condition called carcinoid syndrome. And so that patient doesn't receive an infusion, but they actually receive an injection. So maybe you can talk to me a little bit about infusions, not just infusions, right? I mean, you're doing injections as well?
Different medications have different routes of being given. Some medications can transfer from an infusion to an injection. It really depends on each case-by-case scenario. Some insurances will provide you the service to come in here. Some will want you to get them done at home. So we would have to look at each situation and get with your insurance and see what we can do.
We're talking to Scott a little bit about, again, I'm going to mention the medication, but for osteoporosis is Prolia. If you have something like carcinoid or carcinoid syndrome, there's an injection called sandostatin or octreotide. Octreotide is also an injection. But I think too, we talk about some of these specialty meds, but let's not forget, Brad, that we also work sometimes with wound care centers. Okay, so maybe you have a patient who has a bone infection. We use the term osteomyelitis. So what about that patient who maybe has a PICC line and they need antibiotics? Is that something that we also can do here at an infusion center?
Absolutely. We're not just specialty medications here. We can do IV antibiotics, we can do wound care, we can do port flushes, we can do central line changes. There's a variety of things we can provide here.
What about just fluids, electrolytes? Sometimes we have patients that maybe need hydration, they need IV fluids. But there's some patients that have too much fluids and they need something, let's say Lasix, but they may need it, IV. Tell me a little bit about other things, so we're not just only talking about specialty meds. I know, again, that's probably a good chunk of what we do at the infusion center, but what about things like, IV hydration? I guess in my mind, I think about maybe that patient who is undergoing a treatment, maybe radiation, maybe they're receiving chemo, and they're nauseous and they're sick, and they come and see me in the clinic, right? And you can tell they're dehydrated. they don't want to go to the ER. Okay, I think some patients they'll say, I want to go to the ER only if I have to, and they're nauseous and they're just not able to keep fluids down. And you're trying to keep them out of the hospital. You're trying to keep them becoming so dehydrated that they end up in some kidney failure from dehydration. If I were to try to contact the infusion center or yourself, because I have a patient over here who's undergoing treatment and the treatment's making them sick, is that someone that also could benefit from the infusion center?
Absolutely. Our infusion center is not just, like I said, for specialty medications. Our primary providers in this area can use it as well. IV hydration is a big thing. We do a lot of that. Everybody's seen since COVID how packed our ERs anymore. Our goal is to keep patients out of the ER and ultimately out of the hospital. And the infusion department lets us do that. It lets us do these outpatient treatments to keep our patients well, keep them on the streets instead of in the hospital. By the time this video airs, we will have a plan knocked out for a diuresis program here for congestive heart failure patients to get them diuresis from Lasix. It's a 3-day package to keep them out of the hospital and keep them at home.
So when you're talking about diuresis, you're talking about, again, usually a diuretic, such as, I know we use the word Lasix, and there's different ones out there, but so tell me, who would be a patient that would be considered for, even a diuretic type of a program?
Any kind of patient that's retaining fluids, if they've gained weight maybe 2 or 3 pounds in the past couple of days, they're short of breath, they have a wet cough, they can reach out to their provider and they can get this package ordered. We can get them in here and get them diuresed.
And I think one thing that Skyler alluded to, which was, she's, being a registered nurse, being an RN, I think that, again, too, she's going to also be able to tell whether or not the patient may benefit from admission. I know I can tell you that she also has had patients that, maybe they do need to be hospitalized. And one of the nice things about with this infusion center being connected to the hospital, the patient can actually, if they need to be admitted, can actually be admitted directly through the hospital's program.
Mm-hmm. Yeah, if you come in and your condition's worsened, we can absolutely have the hospitals take a look at you and see if you would need admission.
And I think that's the other thing too, Brad, that's important when you think about having an infusion, because usually if you're getting some of these infusions, you have a medical condition that, again, maybe requires some additional attention. And I do think that patients will have the basically the luxury and maybe the reassurance to know that they are in a hospital. And if I know in the past that if something seems like the patient may have something else maybe going on, with the hospital service right here as well, you can call and one of our providers can actually come and take a look at the patient. And of course, push comes to shove, the ER is just downstairs. Mm-hmm. So if there's any kind of issues with a new medication, concerned about maybe a reaction to the drug, and they're concerned that, hey, I'm not sure if I'm going to be able to tolerate the medication, versus having that at home for the first time, and you're getting a drug at the house, and maybe you live, off the grid, somewhere up a holler somewhere. Here, if you have any kind of issues with that transfusion or with that medication, we have other specialty services right here on site. And again, our ER is just a couple floors down, so we do have an emergency room that's open 24/7.
Absolutely. Not only are we an infusion center, we are actually a hospital with all the benefits with that.
Yeah, and I think that's one of the other things too, Brad, with this infusion center. It's, again, we're talking about big city medicine, hometown care, because I know when I send my patients here, I do think that there is something reassuring to the patient. I do their colonoscopy. I find that they have inflammatory bowel disease. We get the infusion here. They also know that I'm here every day doing procedures, and that if I need to, I can run upstairs, can see the patient, take a look at the patient, be able to make sure the patient, how do they do? And some of these patients, especially with some of these severe, cases of Crohn's disease, they literally tell me that they can start feeling better when the infusion has went in, that they already start feeling improvement. I know that to be true when someone's anemic and they receive a blood transfusion, they get the blood transfusion. And so it's really nice to be able to have all those things all wrapped up, all buttoned up, right here at Plateau Medical Center.
We're here for the community. We have community docs. We have community providers. We're part of the Vandalia Health System. We have access to specialists all across the state. And we're here for the community to provide this service close to home.
Part of being within a larger network, we're not on an island. We do have communication with the providers that also, whether it be the Cancer Center in Beckley, whether it be CAMC in Charleston, we're all part of the same conglomerate. We're all part of the same Vandalia Health, the same family.
Absolutely. One system for the whole state.
Well, Brad, I tell you, I really appreciate you coming on board. We've been talking about the Infusion Center here at Plateau Medical Center. Numbers going to be popping up at the bottom of the screen to contact if you yourself, may require an infusion. I'm Dr. Paul Conley. You've been watching Doc Talk, and until next time, have a good night.